Hello, my name's Yvonne Damanhuri and I thank you for inviting my colleagues and I here to share how the London breast screening services are addressing the impact that service recovery from the pandemic is having on the health and well-being of their staff. In March 2020, the breast screening programme in London paused due to the pandemic. When service resumed full delivery in June, there was a backlog of over 150,000 clients pan-London, and the additional safety measures put in place to protect our staff and clients reduced capacity by up to 50%. At around November 2020, we started seeing an increase in report in repetitive strain injury from staff and an increase in recall rates. We suspected that this could be due to the increase of workloads and anxieties around the pandemic. We sought support from our local occupational health and well-being teams, but due to their capacity also being stretched, they could not offer the support needed without the evidence of need within breast screening. So the leaders in the London breast screening services made the brave decision to produce this evidence. It was decided that we would run a London-wide health and wellbeing survey with the entire breast screening workforce. The survey questions were developed collaboratively with all 6 services, and we had 41 questions in total. We asked staff to share their experience over the period between December 2020 and May 21, so a 6-month period. The area we better wanted to understand was the impact on the physical health of our clinical staff and the mental health of all staff, and how well sighted our staff were on local, regional and national health and wellbeing offers, because we know there are lots of them, but if there were any barriers to accessing them. We received 150 responses in total, which equals almost 60% of the total workforce. Results showed that recovery is having a negative impact on the physical health of our clinical staff. Just under a third reported an increase in work-related upper limb disorder, and of those that reported this, almost 60% of them had not reported this to their line manager. Of those who had reported it to their line manager and sought occupational health support, only 40 of them had received support to address this. Results also showed that recovery is having a negative impact on the mental health of staff. 57% had reported that they had recognised an increase in anxiety levels, with almost a third of them reporting that they were noticing this on a daily basis. We asked participants if they have had to take any time off work due to work-related health problems, and if so, for how long. Results showed that in London, we had lost a total of 94 working weeks of clinical capacity and 83 working weeks of non-clinical capacity. If we hadn't lost that capacity, we would be recovered by now. This meant that the hard gains made by increasing capacity by attracting additional people to come and work in London services was being lost through staff sickness. Another area we wanted to understand better was how recovery was impacting on staff morale. We asked a set of questions exploring this, and results showed that staff morale was very low. Over a quarter of staff had considered leaving the profession altogether, and that was within the last 6 months, or within that 6-month period. And another quarter of staff didn't answer that question, which we felt was actually quite telling. I've included a response from one of the participants that really struck me when I was evaluating the results of the survey, and I would like to give you a moment to read this. Results also showed that staff are facing barriers to accessing the support available to them. Over a third reported that their current workloads do not allow them to prioritise their health and well-being and attend appointments, and that there was limited access to occupational health when they do seek support. I've included 3 responses here that really highlights this. Staff feel that appropriate referrals are not being made for them, that they are promised support that never materialises, and that there are no clear processes to follow, and when there are processes, a lack of response when they do follow them. It is perceived that it is the responsibility of line managers to support staff with their health and well-being. And although this is true to a point, the survey results also highlighted that they too are struggling and they feel they are not being supported to support their teams. This response really drove this message home to me. Line managers are expected to be robots. We are in the same boat as everyone else. We are seeing the same news. Where is our support? On review of the results, to support us to address the areas of improvement needed, 6 recommendations were made. The purpose of the recommendations were to gain better access to appropriate support for staff, better support for managers, who in turn will then better support staff and empower them to prioritise their personal health and well-being. Following the publication of the survey results, London Breast Screening Service leadership wanted to better understand the detail behind the results of the survey and support to develop a meaningful roadmap to change. NHSE commissioned the Imperial HOT programme team to work with our services to do this. I would like to hand over to my colleagues Vasila and Sadie, who will share the work they did with our London Breast Screening Services to achieve this.
Thank you, Yvonne. Hi, everyone. I'm Fazila. I'm a clinical specialist neurosciences occupational therapist, so an allied health professional by background. I'm the head of medical engagement. I'm an improvement lead within the safety surgical improvement portfolio at Imperial NHS Trust in London. So I'm going to explain what HOT is to you using a Japanese storytelling methodology called Pechakucha. I have 20 slides. I get 20 seconds per slide. I'll try not to talk too fast, but hopefully will deliver the story of HOT to you. So a little bit about me. I have these 2 beautiful boys. I hope they grow up to be socially responsible, healthy adults. The things I'm passionate about, coming to work, doing a good job with my colleagues and the patients we're here to look after, to give them a high quality service, manage their safety. I work with incredible colleagues, one of whom is over here with me, Sadie. And what is the HOT program? It's a culture change program. It was born out of a succession of never events that happened within our surgical portfolio at Imperial, which runs about 220,000 surgeries a year, just to give you an idea of scale. And we wanted to incorporate safety, improvement, well-being, using a culture change methodology. How did we start? We started it by doing conversations. We host something called Conversation Cafes, which is the Liberating Structures exercise. If you don't know what that is, I would recommend read it up. It's available on Google. It's a space where you bring people together and create psychological safety for people to be able to talk about the elephant in the room, to be able to flatten hierarchy and really talk about things that matter, speak from the heart and with what has meaning. And what we realized is that there are problems. There are problems where people feel a loss of sense of belonging or an inability to push back against what comes back from policy with targets maybe. This is something that we knew from the work that we've done at Imperial for the last many years now. There is an Imperial culture, a tradition where some members of staff don't feel like it is their place to be able to speak up, where some others feel like it is within their power to subvert that ability to speak up as well. And with that comes disempowerment, unfortunately. We reference the Institute of Healthcare Improvements framework, which is up over here. And you can see it talks about culture and it talks about creating psychological safety within all of its domains. But right in the middle of that is the patient, is listening to the patient's voice. And we consulted Martin Bromley, who, again, if you haven't heard about him, please look him up. He's done some amazing work in the world of human factors. And he recommended to us that if you want a culture change program to actually work, you need to have a lot of backing, not just from your executive board, but from people higher up, from external partners, from your key stakeholders, which is your workforce. So how do we do this? We do this using a number of streams. It's a blended learning program. We have simulation where we give people the opportunity to do non-technical sim, but walk in each other's shoes, understand the nuances about the pebbles in each other's shoes. We do coaching where a pair of coaches will go into a live theater and watch how the team actually performs, not within the technical specialty of their surgery, but how they perform on communication, on team working, on civility, because we know civility impacts safety, and civility has an impact on well-being. We heard a story from a theatre nurse who said, before the HOT program, I would have never questioned a surgeon's behavior. But having done all of the streams of the HOT program, during debrief, when the surgical registrar put his hand up and said, the list was awfully planned, I didn't have the equipment I needed, she said, I would have just passed it off. But I knew this is not appropriate, and I stood up. And it was really empowering to do so. I took it to the CD, clinical director, I took it to the head of clinical practice, and I brought up this behavior, and I said about how are we going to manage this kind of behavior in order to get safer working practices. We have human factors training, which is run across now virtually, and we discuss many important things such as communication, but also provide toolkits for communication, toolkits for being able to assert yourself within a multidisciplinary team. We also provide information about civility, about the impact of rudeness on safety, on performance, and more importantly, on team performance. And what does that do for patient outcomes and for patient safety overall? We have some measures that are attached to a program because naturally you need to understand how well your culture change program is doing, but you also need it for reporting. And we have a survey that we run across the organization. And what we've heard as a result of the work we've done is that there's an increase, 25% increase, for example, in feeling safe and empowered to speak up for safety as a result of being part of the HOT program. We've seen theatre efficiency as a result of the program across our surgical capacity as well. We have 50 operating theatres. So the Institute for Healthcare Improvement has a white paper called Joy in Work. It talks about what are the elements that keep your workforce in work and thriving in work. And if you look at outside, what gives us joy in work? Colors, bubbles, blue skies, green spaces. But what happens within our hospital environments? Usually you have gray walls. You're lucky if you have a window. You're lucky if that window actually allows you to look outside because it's usually coated in dust. So the thing is, it's not really set up for joy in work. So what can you bring to be joyful in work? You have teams. And when teams know each other, when they know each other by their name, when they're not homogeneously in scrubs, but actually have the ability to adopt something that gives them that standout factor, such as theatre caps, they sort of came together. And we started the Theatre Cap Challenge in one of our locations, and it just spread. At Queen Charlotte's, it's one of the things that they just do. They have these named theatre caps. We had to get some procurement as well for those caps. But it brought about a lot of joy. So I began with a Japanese concept called Pechakucha, and I'm going to end with a Japanese ideology called Ikigai. We're very lucky in healthcare. We get paid to do a job that is needed in the world, that is valued in the world, and I think it's incumbent upon all of us to spread that joy, to manage the safety and the well-being of the workforce and our colleagues for better patient outcomes.
So I am Sadie Syed. I am a consultant anaesthetist, and Emma, who is at Gosh, I am that consultant anaesthetist who runs simulation. Generally at Imperial we have a pretty good idea of how communication needs to work in the simulation world. So I want to tell you a little bit about what we've done with the NHSE breast screening service. But before I do that, you can hear from what Fazila's just said to you, we really like conversations, we really like to talk. We like to understand what is going on before we go out there and bespoke a program for that team. So if with that in regard, the fact that we are sitting in an auditorium full of experts, I would like some of those experts, if they would kindly join us up on stage, if two people would volunteer to come and have a conversation with us. For kind of diversity, if you've taken part in our program, we're going to talk about what you've said, but if you haven't, please come and join us up on stage. You put your hands up, Rich and Andy will bring you up on stage in a minute. So we ran the NHSE programme across the 6 London service providers. We ran 8 hot conversation cafes, which Fasila's just explained to you, providing a psychologically safe space to speak up. 117 people engaged with us, and that was over 60% of the workforce, and 60% of that workforce were radiographers, and 9% were managers, which was great because their perspective was really important to us. And we were really impressed. We achieved that educational goal, that miracle. We got one team that had 100% attendance, and we couldn't believe it. And we asked them 3 questions. We wanted to know what it is that was important to them. So we asked them, how would you describe your current work life? You can see here from this infographic that people were frustrated. They were very busy. They were very tired. A lot of people describe joy at work. They liked working where they worked, but they did feel pressured and burnt out. We then asked them, in the context of your professional role, what matters to you? What is important to you? And there was this strong thematic around respect, being valued, finding that important as part of their working day. They thought that was missing. So we asked them to give us some takeaways. If they could change the workplace today or tomorrow, what is the biggest thing that they would ask for? They asked to be valued. They wanted to be given a pat on the back and a thank you for doing the job that they did day in, day out, tirelessly, despite all of the stresses, so that they felt that they were an important member of that team. And these are our key findings. I know a lot of you will know about Maslow's hierarchy for needs, and we couldn't believe how much this was a pure description of the deficiency of needs. People need to feel physically, psychologically safe, feel respected and valued. There were targets sitting over our colleagues, targets that were coming from much further above, but they were causing stress on their normal working day. Yvonne talked about well-being access. There's plenty of well-being access out there, but they didn't know about it, and they didn't know how to achieve it. Once we finish running our programme, we always make these recommendations. We make a recommendation to the NHS breast screening service in London, through Yvonne, to take this away and take a look at what it is that they can do. I like to use the analogy of a big fruit tree. The sweetest fruit is at the top. It's sun-kissed and it's juicy and it feels unattainable because we're down here at the bottom. And we're down here at the bottom, so I can't reach the thing at the top. Does that mean I don't bother to try and reach it at the top? No, it means I go get a ladder and I climb that ladder because it's hard work. We know it's hard work. But systematic and system collaboration is what it's all about. It's getting all of those stakeholders into a room for managers within national NHSE breast screening services to listen to the people in all of their regions in London, what they've said, bring them to the table, make them feel valued. It's about the NHS people commitment. There are low-hanging fruit. When you can't reach that top fruit, there are things that you can catch. Children run along underneath their fruit tree and they can definitely scrump. I bet lots of you, as children, have scrumped. I definitely scrump my neighbour's apples. And those apples are easy to achieve, and it's really simple. All we can do is get face-to-face time with our managers. That's what they asked for, and they've already tried to achieve it. But there are simple things that we all need to take into consideration. Our workforce, you've heard it already today, is changing. The demographic of the workforce in NHS breast screening is mostly female. And it's mostly female and older because they've been doing the job for a while. Is it right that a colleague of yours has to walk 10 minutes away from her mobile van unit to go to the loo and leave her colleague with a patient in a van, knowing she'll be gone for at least 10 or 15 minutes because there is no place for her to go to the loo? I want you to think about it. Would you put up with that? Do we complain about broken toilets in our hospitals or where we're working? Do you sit on a chair that's broken? Does those little things matter? And there's actually an employer's responsibility to provide it, an employee's right to get it. So, having told you all of that, is anybody going to volunteer to come and sit on the stage with us? I promise we're really friendly. We're going to do a fishbowl exercise where you basically listen to our field experience of how the programme ran. And we really want to interact with you. We want you to tell us how it makes you feel, you in the audience who aren't going to join us here up on stage. I want you to click on this on your mobiles, on the internet, go www.menti.com. You can see here on top of the banner, hopefully you need to put in a code, 3412 6205. 3412 6205. We're asking you the question. We want you to listen to the conversation happening on stage and tell us how it makes you feel, what ideas it gives you, and what you might say. Okay, Vaz. 3412 6205.
Thank you, Sadie. Welcome, and thank you for joining us. Do you want to introduce yourselves?
Yeah, I'm Linda. I'm the line manager for the ultrasound department in Hull.
Welcome, Linda.
Hi, can you hear me? Yeah. So I'm Ruth, I'm the Radiology Services Manager at the Countess of Chester Hospital, and I was previously a Programme Manager for a breast screening service.
Welcome. So why don't I start off with Yvonne? This is just a conversation. Yvonne, having done the work you've done, what are some of the things that you know are working currently, and how has it made you feel?
Good question. Slightly different to the one that we prepped for, but yeah, okay. So I suppose, you know, I'm actually in a really unique position or really unique role. Sort of, I started in August 2020, right, straight after the pandemic. Like some people here, this is my first time out of my spare room in a professional capacity in the last 20 months. But my job, for all intents and purposes, I'm working on the London Recovery Programme team, supporting the 6 London services with breast screening recovery. And, you know, day one they put me on workforce and I had 4 projects and like, yeah, okay. We're now at 34 projects. Some of my fellow breast screening heroes are in the room with us today. But my job is to basically get more mammographers into London so we can increase in capacity and recover. And I suppose what became very clear and like what everyone's been saying all day today is we've all read Sir Mike Richards' report. None of these workforce issues are COVID related, but what has been working really well is the passion, and what's very clear is the passion and determination of our service leadership. They really want to support their staff, but they don't know how to support their staff. And I suppose for me, what I felt in my role was that I was in a position of influence because the spotlight's on us. The government, I keep getting emails from MPs about when we're going to recover every few weeks, and I tell them we'll recover when we recover. But so we're lucky enough in London and we're lucky enough in Brest that the wallet is open. Let's be honest about it, we need to recover. And so really saw it as an opportunity to influence. So we have been able to do really nice things with our breast screening workforce like this programme. And what we're hoping to do is to use this work to influence elsewhere, you know, to be able to help other workforces.
I can see how emotional it's making you. And those who've seen me present at the Improvement Board nationally, I was in a similar situation and I was presenting the work across to them because it made me very emotional to hear about my fellow colleagues and the kind of things that they had reported that were affecting their morale. How does this make you feel, Linda?
I hear things like the wallet is open and I go, wow, we're in
I know, we're very lucky. Well, not for much longer. We're nearly recovered.
It takes us weeks and weeks and weeks to get a post passed that's just a direct replacement because everybody ignores our emails saying they need this post.
Yeah, getting post pass is
just
a big
a direct
deal,
replacement, and we know there's probably nobody out there to replace them anyway. But
Yeah.
It's
What about you? What are the thoughts coming up for you?
Yeah,
having
sort
heard?
of echoing those similar kind of things, that although the wallet is open, people have got to a stage where it doesn't matter what you pay them, actually they're just too tired. They haven't got any time to spend the money. During the whole lockdown things, there wasn't anywhere to go anyway. And there was a certain things at the beginning where people were saying, well, there isn't anywhere to go, so I might as well come to work. But then they were just so tired that you say, you can't pay people enough. The things that I'd heard about, the targets things, is absolutely true. Take the targets away, they'll recover it, and they will do it, but they don't need that hanging over them. And they'll do it because they're a team, and they're a brilliant team, and if you support them, then they will do it.
Thank you. I don't know if you could hear that at the very back, but the targets thing is absolutely key around sort of being able to lobby and push back. And I know we have a national recovery plan, and I know we have loads of patients waiting, but it sounds to me like we're on the right path, but we need to look after our people. We need to really live that NHS people plan out, actually. Yvonne, what are some of the things that are being done in response to the recommendations?
So Fazila and colleagues and Sadie and colleagues sort of wrote a report for us and made the recommendations, and what I was really keen to do is to use that, and again, this is what I've realised in strategy or NHSE is that actually when something's written down and evidenced, that we have to do something about it. So what I was really keen to do is to use that to actually gain commitments. So we've created a commitment plan. So each of our service leaders have done sort of service level commitment plans. So what exactly is going to be done for the work.
Give us 2 examples of those commitments.
So I know that, reviewing how,
I heard about a garden.
Yes. So one of our services is going to, so we've been able to issue some funding. It's not an awful lot of funding. We were able to offer our services £2,000 each, and someone is going to build a garden so that staff can have lunch together outside. Some of our services are going to buy their team ice cream because that was their workforce generated idea for morale. And I know it's not the norm, but like if they say that and we don't do that, basically, if they say this is what we need and we say no, then we're actually proving what they're saying to us, that we don't care, we're not listening. So there's bits and pieces like that, but I think what's more important is what I've been able to do is get talking about and looking at the targets, because it's us that sets them, NHS England set them, and is a commitment from our national breast screening programme team and our regional breast screening programme team, so the commissioners, that they have to recognise that we have to advocate for our services, and we need targets because that's what keeps us on track and it helps us to see where we're going and where we need to be. Like there's, you can't get rid of targets, but it's actually about how do we manage them and how do we push back when they're being unrealistic. So, and I feel like we've got that commitment. Now, we might need to remind people that they've made that commitment, and that's where you pull the document that's in writing out and say, do you remember when you said that you were going to help us with this? So, yeah.
Thank you, Yvonne. Do you guys want to add anything? Is there any reflections that are coming up for you that you'd like to share?
The only other thing that I was going to say is that it seems to me as though you have just acted as a sponge, and that you need to have somewhere to actually squeeze that sponge out yourself to reflect your own wellness as well.
Oh yeah, 100%. I'm going on leave very soon, so yeah.
What about you, Linda?
I'm okay. Not sure really.
No? Sadie, any reflections from you?
Well, it's interesting, some of the things that people are saying. I mean, they're clearly feeling the emotion that's on the stage, which is great, which is what we kind of asked for. And I will share a story. One of our conversation cafes, in one of the service areas, they'd said, the doctors come in, we're in the middle of a break, we literally have sat down for like 30 seconds, and then they will ask us to do something as an emergency, and don't we care about the patient? Obviously we should get up off our backsides and do it. And they say it in such a way as if they're not members of the team, and it's a demand. You know what, I heard that conversation, and as a doctor who works in very busy teams, I'm a trauma and vascular anaesthetist, it hurt me that my profession would be so desperately rude. We all have pressures. I have pressures when I come into work. I've got a patient who's incredibly comorbid, incredibly sick, who has every risk of dying on my operating table. However, my right hand is my ODP. Without them, I don't function. Getting people to understand how important that is really, really powerful part of communication. So all the things that you guys have described here, sitting on the stage in front of us, those are really important, because a lot of the mistakes we make in the NHS is this lack of communication. You know, we have all of these targets and all these things, and the staff are stressed out because of the targets, but nobody's explained to them why we have those targets. Nobody's listened to them about whether the targets are achievable. These are the people doing the job. And yet, all they're asking for is for somebody to tell them. In the same way, I ask my profession to be civil to all of those around them, because ultimately they're doing the job just as hard as we are. So it's really, really important that we learn to work as a team, and that's the culture change that Fazila and I and our team in HOT, desperate to spread across the NHS. So I'd like to thank you all for listening to us this afternoon. I'd like to thank you for all the contributions you've made here on Mentimeter. I'm really glad that you find us being frank, Yvonne being incredibly frank, is important to our own learning. So thank you.